Hello, my name is Shannon Stanley, and I'm going to be taking you through this presentation on medical terminology. The objectives we would like to gain from this presentation is for you to have an understanding of the word forms and the rules surrounding medical terminology, specific terminology that's very important for you to learn before embarking on your course, how to use medical terminology to identify an injury or a complaint on the human body, and different directional terms. Medical terminology is the language that medical professionals use to communicate in a medical team, to describe body parts and diseases and different medical procedures, and to describe and document the location of injuries and complaints on the human body. When looking at word forms, medical terms consist of one or more root words and a prefix or a suffix. So a prefix or a suffix is something that goes before or after the root word, which gives it description about what's happening. And the root word is usually relating to a medical condition, an organ or a body part, as well as a medical procedure. Having a look at an example here, the word hemiplegia. Hemi is the prefix word meaning half, so it's describing half of something. Plegia is the root word meaning paralysis. So when we have a look at this word joint together, hemiplegia, this means that there is a half-sided paralysis on the body or the limb. Looking at another word now, gastritis. You may have heard of this before. Gast is the root word here, meaning stomach. Itis is the suffix, which is this describing word meaning inflammation. So when you put those two together and make gastritis, it means inflammation of the stomach. Building up a good vocabulary of the prefixes, the root words, and the suffixes in medical terminology will really help you in your career, especially when you are faced with a lot of very complex medical terms. Having a good understanding of these different prefixes, root words, and suffixes will help you to be able to break these complex words down and actually get a good understanding of the condition of the patient or the procedure that they have to go and get done. Like in any other language, medical terminology has a few general rules to be aware of. One of these rules is to use a combining vowel between words that begin with a consonant. An example of this would be the word angiography. Angi being a root word here meaning blood vessels, and graphy is the suffix meaning recording. If we were to try and pronounce these words without having that combining vowel in between, it would sound something more like angiography. Having a combining vowel in between these two words starting with a consonant makes it roll off the tongue a lot easier and sound a lot smoother. With the combining vowel there, the word now sounds like angiography. We also use a combining vowel between two different root words. An example of this is the word electrocardiogram. Electric, meaning electrical, is one root word. Cardi, meaning heart, is the other root word. And gram is the suffix meaning recording. If there was no combining vowel again in between these words, it would sound something more like electric cardiogram, which doesn't sound all that good. But when using the combining vowel in between, again, we have that smooth flow of words and easy to roll off the tongue. So we're left with the words and the pronunciation of electrocardiogram. So just be aware that there are a few common mistakes that can be made because there are many words that sound the same but mean different things. An example of this would be ectomy, tomy, and stomy. Now those all sound very, very similar, but they mean slightly different things. So ectomy is when there is an excision or removal of something from the body. A tomy is to cut into, and stomy is the forming of an opening in the body. Be aware that some words may sound exactly the same or they're pronounced the same, but they have very different spellings and mean quite different things. So the term ilium and ilium, one meaning of the word ilium is talking about or relating to a part of the pelvis or the hip bone, and the other term ilium means part of the small intestine. They sound identical, but their spelling is slightly different. Then there are other words that are spelt the same, but the pronunciation is different, and that's what differentiates which part of the body that you're talking about. An example of this is the word cervical, or otherwise pronounced cervical. So depending on the pronunciation, this could just mean that it's pertaining to a woman's cervix, or cervical is talking about the portion of the spine and the neck, and also the term cervical collar. That's the collar that goes on that upper portion of the neck over there. So just be careful about how you pronounce those words. Avoid using the US spelling. This can be quite a difficult task to do, as most of our textbooks and literature that we read is from the US, but just be aware that these are the correct and incorrect spellings of these words. So the correct way to spell edema, which is relating to swelling, is with an O in front of it. The incorrect or American way is with just an E in front of it. The correct way of spelling anemia, which is pertaining to blood, there's an A before the E within that word, and the American spelling has actually dropped the A. Pediatrics, relating to children, again we have an A before the E in the word pediatric, whereas the American spelling is just with an E. And the word tumor, relating to a cancerous mass, has an OU inside the spelling before the R, whereas the American just has the O present. So just a quick test on what you have learnt so far about medical terminology, and if you have got a bit of a vocabulary already when it comes to your prefixes, root words and suffixes, this will be quite easy for you. So what do you think the following words mean? Myocardium. If we were to break down myocardium, one section of the word would be myo, which would be a root word pertaining to muscle. Cardi would be a root word pertaining to heart. So if we put those two words together, we get the heart muscle. Next is the term hypoglycemia. Hypo is relating to a prefix meaning low. Glyce is a root word meaning sugar, and emia is also a root word meaning blood. So if we put those all together, it will mean low blood sugar. The next term is polyuria. Poly is the prefix which pertains to many or a lot of. Urea is the root word meaning urination. So polyuria means to urinate frequently or to urinate a lot. The next word is the term dyspnea. The prefix here meaning dys, which means difficulty, and the root word over here is pnea, which means breathing. So if we put those two words together, that gives us the term difficulty in breathing. Now we're going to have a look at some positional terminology. So it's very important to have a good understanding of this, again, because it helps you to document effectively and also to relay information to other medical experts efficiently. So the first few words we're going to have a look at is the position that a body or a person can be in, either when we find them on a scene or the position that we place them in to help with that medical condition. The word supine is relating to somebody laying flat on their back, face up to the sky. The word prone is relating to somebody laying face down. And the word lateral or lateral recumbent is when a person is laying on either of their sides. The next terms that we'll look at are proximal and distal. So these terms help us to relate something to the point of attachment. What that means is that if something is distal to the point of attachment, it's the furthest away from the point of attachment. If my shoulder is the closest point of attachment to my trunk or my body or my chest. The most distal point is my fingertips. So my fingers are distal to my shoulder. Proximal means that it's the closest point of attachment. My shoulder would be proximal to my fingertips because my shoulder is the closest point of attachment to my trunk versus my fingertips, which is my most distal point of attachment to my trunk. The next two terms are describing where something may be in relation to the midline running down the center of the body. So when something is lateral, it means it's to the side of the body. Whereas if something is medial, it means it's in the center of the body. So I could say my belly button or my umbilicus is medial to the center of my body, whereas my hip bone may be lateral to the center of my body. So this is where the midline is on the body. The midline runs from the very top of the head straight down the center of the body, and it splits the body into left and right hand sides. Be aware that when you're trying to describe where something is on the patient's body, that you should be using the patient's left or right hand side, not your left or right. So when you actually look at the person, this is their left hand side, the midline's over here, and this is their right hand side. The umbilical line is the line that divides the body right through the center, right through the umbilicus or the belly button, and it divides the body into the top and the bottom portions. And the medical terms for that is the superior and inferior. And we use the word superior and inferior to describe anything above or below a point that we are talking about. So to use this as an example, we could say that the head was superior to the neck, or that the collarbone or clavicle was superior to the second rib. And we could also say that, say, the fourth rib is inferior to the third rib. So it's just being able to describe things as either being above a certain object or below a certain object. We've already seen the words proximal and distal. So proximal is closest to that point of attachment to a joint or to the trunk of the body, and distal meaning the furthest away from a point of attachment to a joint or point of attachment to the trunk of the body. Lateral meaning away from the midline, and medial is towards the midline of the body. There are some specific lines that we use just to describe something that is on the chest. These specific lines cannot be used to describe things anywhere else in the body, so it's just used for describing either a location or an injury on the chest of a person. So we'll use the midline the whole way through the body, but we can also use the term mid-sternal line, because that's the middle of the sternum over here on the chest, that breastbone that's on the middle of the chest over here. Another line we can use to describe the location of something is the mid-clavicular line. So this is the collarbone or the clavicle running from the sternal notch over here to the process on the shoulder, and the middle of that clavicle is called the mid-clavicular line. And if we draw a line straight down the body to the bottom of the chest, we can use that line to describe things or narrow in on a location on the chest. Another line on the anterior or the front of the chest is called the anterior auxiliary line. So auxiliary meaning the underarm or armpit. The front portion of the armpit is the anterior auxiliary line running down the front over here. Continuing on with looking at the different auxiliary lines, if we have a lateral view of somebody or a view of somebody on the side, there's that anterior auxiliary line running down the front of the axilla. We had the mid auxiliary line running down the middle of the axilla. And then we have the posterior auxiliary line running down the back of the axilla. So posterior meaning back, anterior meaning front. So as I've mentioned already, these lines we are only using to describe a structure or a position on the chest, when we're having a look at other portions of the body, such as the abdomen or the pelvis, we can use different lines there. When trying to describe the location of something on the abdomen, you can make use of either the 9 abdominal regions, which is depicted on the diagram on the left-hand side of the screen, or what's more commonly used is the 4 abdominal quadrants, which is depicted on the right-hand side of the screen. Now, how we define the borderlines of the 4 abdominal quadrants is we use the midline running from right down the center of the body, dividing the body into the left and the right. And we also make use of the umbilical line, which is the horizontal line going across the body through the umbilicus or the belly button, and that divides the body into the top and the bottom, or the superior and inferior. And this is what gives us our 4 quadrants. So we have a right upper quadrant, left upper quadrant, a left lower quadrant, and a right lower quadrant. So we're going to walk through a few terminology exercises together. We're going to make use of not just the lines that we've spoken about in the chest and the abdomen, but also some of the underlying structures such as the rib cage, the clavicles, and the pelvis, because we can also use bones to help us describe a location of where something is. Just a refresher, there's that midline again, running from the straight down the middle of the body, from the top to the bottom, dividing the body into the left and right. The midclavicular line, the anterior auxiliary line, the nipple line, which runs through the nipples as the horizontal line in the chest, and the umbilical line that runs through the umbilicus, horizontal line again, dividing the superior and inferior portions of the abdomen. There's our first location that we have to try and identify and explain. If we get our lines up to help us, this is going to make things a lot easier. First thing we want to know is this on the left or the right hand side of the chest? In this diagram, this location is on the right-hand side of the chest. Looking at the lines of the chest, because those are the lines we're going to be using to identify this location, not the lines of the abdomen, we can identify that if we take that midclavicular line across to the other side, that this dot would pretty much be on the midclavicular line on the right-hand side of the chest. Just like how you're trying to locate a position on a map, you need to have the latitude and longitude to be able to find that exact point. The same thing as when we're trying to find a location on the chest. So we've got that midclavicular line as one point, but midclavicular line runs everywhere from the clavicle all the way right down to the bottom of the ribs, or the bottom portion of the chest. So it could theoretically be anywhere along that portion if we just said it was on the right hand side of the chest midclavicular line. So we have to make things a bit more specific. We need to give another location of where that could be. And this dot seems to be sitting directly on top of the second rib, doesn't it? So we could use the second rib as the exact location on the midclavicular line of where this dot is. So if I was trying to describe this to another medical practitioner or document this on my paperwork, I would say that the location of the injury was right-hand side of the chest, midclavicular line, second rib. Or I could also say right-hand side of the chest, midclavicular line, and that it was about 3 or 4 centimeters lateral to the midline. Our next location over here, we'll get up our lines again to help us identify exactly where that is. Having a look at this location, left or right hand side of the chest. It's still on the chest, so we're going to be using our chest lines to describe where this location is. What line is it closest to? It's the closest to the midclavicular line again. So we could say that this dot is about 1 centimeter lateral to the side of the midclavicular line. We could also state that this dot was on the 7th rib, or we could state that this dot was about 3 centimeters inferior to the nipple line. So to document this out, or to state this to another medical practitioner, I could say that the site of the injury was left-hand side of the chest, 1 centimeter lateral to the midclavicular line, and 3 centimeters inferior to the mid-nipple line, and that's where I'd be giving my exact location. Here we have another dot or injury location. This dot is no longer on the person's chest, is it? If we bring up all the lines and anatomical markings, how are we going to then go about describing where this injury or this dot is? We can't use any of the chest lines because it's no longer on the person's chest. However, it is on the position of a long bone. And this is where we can use our terms such as proximal and distal to describe where the location is closest to the point of attachment. So this bone in the upper arm is called the humerus, and that dot is at the highest point on the humerus, closest to the point of attachment. So if distal is furthest away, but proximal is closest to, we could say this was on the proximal portion of the humerus, meaning that it's the closest portion to the point of attachment. Now, with our arm, we need to then define whether this is on the front portion of the arm or the anterior portion of the arm, or if it's on the back portion of the arm. We would state this was on the anterior portion of the arm, the proximal third of the humerus. If the dot, however, was here in the middle, we would say that that was on the anterior portion of the arm at the mid portion of the humerus. If it was here, however, we would then say that it was on the distal portion of the arm, and also just stating that that's the anterior. Our next dot that we get up, again, we're looking at the arm. So we're not allowed to use any of those chest lines or abdominal lines. This portion of the arm would be the distal portion of the arm, wouldn't it? But this is where something can get tricky. If somebody's facing forwards, but they have their hands behind their backs, we're actually looking at the lateral aspect of the elbow over here, or the lateral aspect of that humerus. Because if the person was to extend their arms out into the anatomical position with palms facing forwards, this portion over here, which is closest to that elbow joint, would actually in fact be on the lateral portion of that arm. So the way that we would describe this on a person, we would say that this was the lateral portion, distal third of the humerus. Now we're going to sections of the abdomen. So again, getting up our lines, we can see that we're not allowed to use those chest lines as location points. We're now going to be using the lines and the quadrants of the abdomen to describe where that location is. So this location here is in the right upper quadrant. So the right upper quadrant is rather large, and we need to be able to, again, pinpoint exactly where it is in the right upper quadrant. So this dot over here is closest to the umbilical line. So we could say that it was 1 centimeter superior or above the umbilical line, and it's about 4 or 5 centimeters lateral to the medial line. So we'd state overall that this location is in the right upper quadrant, 1 centimeter superior to the umbilical line, and 5 centimeters lateral to the medial line. Here we have another point on the abdomen again. So we're going to be using abdominal lines to describe where this is. So this is now in the left lower quadrant of the abdomen, and we can use the umbilical line to state that this is about 3 centimeters inferior or below the umbilical line, and it's about 5 centimeters lateral to the medial line. This is also the location where you might start to feel the anterior portion of the hip here, called the iliac crest. So we could also in this case use the bone to describe the location of this injury. So we could state this injury is in the left lower quadrant, right on the iliac crest. So now the dot has moved off the section of the abdomen and the pelvis completely, and it's actually on the higher portion of the leg over here. So we're going to be using the bone that it sits on to describe its location. So the bone in the upper portion of the leg, or the thigh bone, is called the femur. Now this is in close proximity, or is proximal to the point of attachment onto the trunk. So this again would be the anterior portion, so the front of the body, proximal being closest to third of the femur. So long bones we like to divide into 3. The proximal third is the third that's closest. The midsection of the femur would be the middle portion, and the most distal portion would be the distal third. We also have medical terminology to help with directional terms and movement of body parts. And the reason we need to have an understanding about these different types of directional terms and movement terms is that when we assess a patient for any kind of injury or illness, we want to know what their capabilities are, their physical abilities are, and if there's any neurological or tissue damages involved. And by being able to assess these things appropriately and document them appropriately, we're giving a more thorough picture to the reader of our case sheets, and also giving a more thorough picture to those that we hand over to. We have the terms flexion and extension here, and you can see in the diagram on the left-hand side, flexion of the bicep would be the ability of somebody to bring or raise their hand up towards their chest, and they'd be flexing that muscle there. And extension of the bicep would be when it relaxes now and the arm moves downwards or extends down. The same can be used on other body parts, and we have a picture on the right-hand side of somebody moving their head backwards and forwards. Extension of the neck would be the neck moving right back and the head tilting backwards, and flexion of the neck would be the neck moving forward, so the chin to chest position. So here we could say, for example, that the lady on the right, if she had experienced some kind of neck pain, we would ask her if she's able to extend her head backwards or flex her chin to her chest, and then we would document our findings. So we could say that she had good range of movement, no pain on extension, but the patient experienced pain on flexion of the neck. When something moves towards the body, it's called adduction, so you're adding towards. And when something can move away from the body, it's called abduction. Using this in a case of assessing a patient, if somebody maybe was complaining of neck pain or back pain from a spinal injury, or even shoulder pain from some kind of trauma or injury, we could try and assess them and ask them to either lift their arm up to the sky, so have that shoulder abduction moving away from the body, or moving their arm closer to their body, having that shoulder adduction. And then we could also relate this to another medical practitioner, or documented that the patient had difficulty with adduction but was able to perform abduction. We also have the lateral and medial rotation, as you can see depicted in the diagram here, is the movement laterally to the outside and the movement medially towards the midline of the body. Conducting an assessment of someone's capability of either being able to rotate laterally or medially their different limbs, again, gives us a very good idea of what kind of underlying damage there is to their tissues. And we also need to, again, report that and relay that over in our medical handovers. This concludes the presentation on our directional terms and medical terminology. Please ensure that you start to build up your vocabulary regarding your prefixes, root words, and suffixes, as this will help to aid you in your studies and throughout your career.